Changes are coming that may make it easier for people to get their pain medication. As it stands now, some people have to go to half a dozen pharmacies to get their prescriptions filled, even if they have well-documented medical conditions.
They say they're victims of the pill mill crackdowns. Erica Washington first broke this story back in February. Now it looks like lawmakers are starting to realize something has to change.
I feel that there's no reason whatsoever that I should not be able to get this medicine. I go to the doctor, I take a urine test, they determine that I'm not selling the drug to anybody else. They know I'm not abusing the drug, yet I still have problems getting it.
Joel is frustrated. We're not using his last name because he takes a prescription narcotic for a painful spinal cord condition you can see on this x-ray.
The spinal cord is it's really good and thick there, and then right when it hits the 5 vertebrae it narrows and you can see where it indents. Those are the vertebrae pinching in on it right there. It's like having an internal sunburn in your arms and legs 24/7.
Even though Joel's been taking 4 hydrocone a day for 8 years to manage his pain, sometimes he still has trouble getting it from his mail-order pharmacy.
I called the mail-order pharmacy and I said, well, what's happened? And they said, well, we've delayed you up to 7 days. And I said, well, why? And they said, well, because we have to check the database to see if you're eligible to receive this medicine. And I said, well, what, am I a drug addict? And they said, no, we're not saying that.
Allison Dudley is the executive director of the Florida Board of Pharmacy. She's heard story after story just like Joel's and worse. She says the problem started in 2011 when Attorney General Pam Bondi cracked down on pill mills in the state. That, coupled with the DEA leveling multi-million-dollar fines on CVS and Walgreens because of how companies were filling narcotic prescriptions. Dudley says it's all had a chilling effect on pharmacists.
There's some confusion among pharmacists about their responsibilities under federal law.
To try to make it easier for legitimate pain patients like Joel to get their meds, the board is proposing 2 hours of additional training for Florida pharmacists. But some say that's not enough. Laws need to change. State Senator Aaron Bean chairs the Health Policy Committee in the Florida Senate.
Now, under current state law, a wholesale drug supplier must assess orders of more than 5,000 doses of any one controlled substance in 1 month to determine if the purchase is reasonable. Now, Bean's sister, a pharmacist, believes that extra scrutiny is keeping pharmacists from ordering what they need to serve all of their patients.
She says we can't have enough of this pain medicine in stock. We can't have it, and we want it, and we should be able to do it, and it breaks her heart when she turns people away.
Bean's committee will sponsor a bill next year to get rid of those 5,000 dose limit in hopes it will improve the situation. Joel says that solution can't come quick enough.
They need to just find a way to separate out who's legitimate, who is not, and like the doctor says, if I write the prescription, fill it. It's as easy as that.
Now, DEA agents spoke before the Florida Board of Pharmacy a couple of months ago. They said everyone with a legitimate need should have access to their meds. So to see more on Erica's previous investigations into this problem, we posted a link on our website. Just head to facebook.com/news6. You'll see it at the top of the page.